And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So what do you think about this?
It's always been controversial. We have to keep up with those guidelines. They always are re-looking at how frequent you can do those. Certainly just have to have a conversation with your physician. I think just like the segment indicated, most patients just want to have that screening, that reassurance every year. But I have found some patients who, as they get older, they tend to not really want to do that as often, and I think some research supports that. So I have been promoting that if I have a patient who's not quite as interested in doing the mammograms every year, maybe every other year, maybe every third year, but I always recommend they check their breast once a month, do a self-breast exam, and certainly if there's anything suspicious, we can always do the mammogram at any time.
All right, on to some of our viewers' medical questions. This person says, I have ant bites on my foot from about 3 months ago. The itch still wakes me up at night. I have never had an ant bite problem for this long. What can I do to resolve this? It's driving me nuts.
Well, you know, our old friend neuropathy actually feels like ant bites, and certainly could be neuropathy, or it could just be trauma from the ant bites itself. Probably because it's so mild, would start off with some anti-inflammatory medicines or Tylenol. Although it could be a nerve pain as well, I would probably try Lyrica or Neurontin. It shouldn't be too difficult to treat. I certainly probably would get some foot x-rays or even a nerve conduction study to make sure nothing else is going on.
Okay, what is the best treatment for a sciatic nerve problem?
Really, the best treatment is to relieve pressure. Most of the time, sciatica is related to pressure on the major nerve in the back of the thigh on both sides. A lot of people have it if they drive a long time, so actually getting up and moving around is the best thing to do. Or if you're at work and you sit a long time, getting up and moving around. If not, good, we can try Lyrica or Neurontin for nerve pain.
Okay, how severe can a case of pneumonia be, and is there a new pneumonia that doesn't respond to antibiotics?
To be honest with you, pneumonia can kill you. It can get very severe. We see that a lot in the elderly patients who have a lot of comorbid illnesses like COPD, heart failure. They have diabetes, poorly controlled. Pneumonia can kill them. We see it all the time, especially during the flu season. I don't know of any new pneumonias. We deal with the same ones every year, bacteria and viral pneumonias. If you're on immunosuppressants, you could have fungal pneumonias as well, so it can be pretty bad.
Is there a vaccine for pneumonia?
Absolutely. It's called pneumonia vaccine, and we recommend it for most patients, above the age of 18. You can get that probably every 5 to 10 years. The more medical problems you have, the more likely you need that sooner rather than later.
Okay. I have bad teeth due to an accident that happened when I was 15. I have 4 lumps under my jaw, 2 on each side. It's because of my teeth, or could it be something else? I can roll the knots side to side, and only sometimes they may irritate me.
I probably would suspect that without examining him, but certainly just based on his description, I would assume it's probably from poor teeth, gingivitis, gingival inflammation. The lymph nodes underneath the jaw tend to get a little bit enlarged, as they should be if they are infected. But certainly you want to make sure it's nothing else. Lymphoma, blood disorder, can present with a lymph node enlargement. So I would certainly get that checked, maybe with an x-ray or even a biopsy of those lymph nodes.
All right. We've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. An 86-year-old woman with diabetes has taken Coumadin for years. She saw a study saying people should not take it after 80 years old. Why, and what else can be taken?
Well, there's always a risk of bleeding, and we always think about that, but certainly if the person is a young 80-year-old, I would probably certainly continue it. The way we look at it is if a patient starts to have bleeding complications, then we probably would recommend stopping the Coumadin, trying maybe aspirin or Plavix. But just based on age alone, we normally don't make that decision. It's got to be because they're bleeding excessively.
Okay. This person says their kneecap is swollen with no fluid. The doctor has prescribed drugs. What would you recommend?
Probably anti-inflammatory medicine. Swelling normally indicates inflammation. Tendinitis is a very common problem. We're typically overweight in this society, and it tends to wear out the knees, and they become inflamed, so I'd probably do an anti-inflammatory Motrin to Advil.
Speaking of overweight, can being overweight be a cause of COPD for someone who never had asthma or smoked?
I've never heard of it, but certainly secondhand exposure to smoke can cause that. So a lot of people, their parents smoke or their spouse smokes, and they're just sitting in the environment, and they can have some of the same illnesses as a smoker, but not weight in and of itself. Now, being overweight can cause chronic lung disease, but not COPD in my opinion.
Okay. This person had a vena cava filter put in 2 weeks ago, and they've been having back pain ever since. It's getting worse by the day. Have you ever heard of these things causing problems? They went to the ER and nothing was done, but the pain is unbearable.
I think anytime you have any procedure and you have any type of pain subsequent to that procedure, to get back to the physician who performed the procedure to make sure that there hasn't been any complications. But to answer your question, absolutely, it can cause disruption of blood flow. It can cause backflow of the venous system. It can cause excessive swelling, pain, and poor circulation to the legs. It can be a mess. So certainly I would advise this person to get back to the physician who perform that procedure.
Okay, a 94-year-old is having trouble holding urine, especially at night. What can be done?
You know, a lot of times just related to aging, a lot of issues, medical problems, disconnection between the brain and the bladder. The bladder wears out over time. They tend to retain bacteria in their bladder, so this can be a common problem. Sometimes we'll try medications like Detrol, oxybutynin. Sometimes an easy fix, unfortunately, is just to wear an undergarment because medicines have side effects that we always have to deal with: constipation, dizziness. Certainly get to a urologist to make sure there's nothing like bladder cancer, because that sometimes creeps there, especially if the urine has blood or bacteria in it.
Okay, what can be done to avoid dialysis when diagnosed with kidney problems?
Probably treat the problem that's causing the kidney problem. In this society, high blood pressure, diabetes, the two biggest ones. So get the blood pressure down, get the diabetes down, and you shouldn't have progression to the kidney failure.
Okay, what could cause someone to feel sick every time after they eat?
I would probably think of acid reflux, acid ingestion. Hiatal hernia is a very common problem, so when you eat food it can cause some indigestion. I would also think of maybe gallbladder disease, especially if they have vomiting or pain of their abdomen. Might try a Pepsid or Tagamet to alleviate some of those symptoms.
Okay, does type 1 diabetes somehow cause indigestion?
It can over time, because it causes what we call a gastropathy or nerve damage to the gastrointestinal tract where it just doesn't move as well. So when you eat food, it kind of sticks there and can cause an indigestion, a nausea, loss of appetite. We can treat that with very few medications. We can also add an acid reflux medicine like Pepsid. So yes, indeed, it can.
All right, Dr. Levine, as always, we appreciate you taking the time
ma'am.
to stop by, and you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, email us at laf@kftm.com, or post those questions every Monday on our KFTM News Facebook page.